For today, I would like to talk about painful and clicking fingers. It's called trigger finger. Maybe some of you have experienced this problem. What causes trigger finger? Normally, when we flex our finger, there is a long tendon that pulls the finger and helps it smoothly slide through a protective sheath that surrounds it. In cases of trigger finger, the protective sheath can become inflamed with repeated use such as typing, texting, and other hand manipulations. When the sheath is inflamed, the tendon cannot slide smoothly, thereby causing the finger to click. It can affect any finger. It can affect the thumb. With repeated clicks, the tendon can also become inflamed, causing a nodule like a scar to form. A picture of how our hand works. We have tendons that attach to our finger bones, and this is how we bend our fingers. Okay. In cases of trigger finger, as you can see, there is a nodule at the base of the finger, and this causes the painful clicking. What are the risk factors for having trigger finger? Persons around between 40 to 60 years old, they are more at risk. Female are more commonly affected than males. Another risk factor is when you keep on using your hands. People who frequently grip and handle things like for work, hobbies are more prone to get trigger finger. Too much typing, texting, or working out with heavy dumbbells may also cause this. Those who play musical instruments for long hours are at risk. People with diabetes and arthritis are more at risk of getting trigger finger. So I'll be teaching you the treatment for trigger finger. For mild diseases, you can just rest your hand for a month. This can help improve symptoms. Avoid repeated gripping. Be aware that too much gripping can worsen a trigger finger. Avoid using vibrating machines. Try soaking your hand in warm water. This can help reduce the pain and the clicking, and you have to protect your affected finger and your affected hand. I will be showing you some simple exercises and stretches for trigger finger and also for other hand conditions. In trigger finger, there's usually a nodule at the base of the finger. If it's the thumb, it's located here, or if it's the finger, it's located here. One thing you can do is you can massage the nodule as I've shown you. Try to massage it gently, clockwise, counterclockwise, for 1 to 2 minutes, maybe 2 times or 3 times a day, and try to stretch it slowly. Don't injure yourself afterwards. You can see if this works or not. If it doesn't work, you have to see your orthopedic surgeon or a hand surgeon. The doctor might do some steroid injection. Doctors may inject a steroid solution near the base of the affected finger. It's not that painful and not that expensive. This injection is more effective, the steroid injection, if you give it within 1 to 2 weeks from the onset of symptoms. So you have to consult your orthopedic surgeon early. And if this steroid injection doesn't work, there's also a surgical release of a trigger finger. Hopefully, we don't have to come into that. I will show you some simple exercises, not only for trigger finger, for carpal tunnel syndrome. Carpal tunnel syndrome is when you have numbness and pain and sometimes weakness of your hand. I'll show you some simple exercises. You can follow me. Try to open and close your hand 10 to 20 times. Okay, try to stretch and loosen your fingers. After 20 times, try to open and close like this. Try to feel the stretch. I can feel the stretch. Our hands are very important, so we have to keep them in shape. Afterwards, you can try some maneuver. This maneuver is used for carpal tunnel. So in carpal tunnel, you have to go into certain positions for 5 to 10 seconds. Okay, just follow me. This is the claw position. Gently, 5 to 10 seconds. Next is the half fist position, 5 to 10 seconds. This helps the tendon to glide and slide. Next, you do the tabletop. You can do this for one hand or both hands. Then you do the closed fist, completely closed fist, 5 to 10 seconds. You can do this 2 to 3 times a day. Okay, 2 to 3 times a day. And there's one simple exercise. You just, turn your hands around. Keep your hands higher than your heart so the swelling will be less. I'll just show you 2 last simple exercises. You can do this for 5 to 10 times. Bend downwards 5 to 10 times to loosen your hands. Then bend upwards. You can do this 10 times, maybe at most 20 times if you want to rest your hands. Then try to turn it around. If your finger clicks, that's okay. We're trying to loosen and condition your hands. Okay, so those are my simple exercises for trigger finger, for carpal tunnel syndrome. I hope this helps you. And if it doesn't work, if you have trigger finger or carpal tunnel, if it worsens, you have to see your orthopedic surgeon. Thank you very much for watching. God bless everyone.